Hello, Wasako. Today we will learn basic physioanatomy of the heart. Heart is a pump that pumps the blood in the whole body to send the oxygen and nutrients around the body. And what body does with that oxygen and nutrient, that is totally a different topic. We will need a separate video for that topic. So let's stick to our topic. We will just learn the basic physioanatomy of the heart in this video to get the idea. So when we dig deep in the topic, just like arterial supply or venous drainage of the whole body or pulmonary circulation or portal circulation or blood pressure etc., we would have a grip to basic physioanatomy. Heart has four chambers, two upper and two lower. Upper chambers are called arteria and those are collectors of the heart. They are separated by intra-arterial septum. Let me show you. This is intra-arterial septum. Ventricles are more muscular than atriums. The left ventricle is indeed thicker than the right one because the right one supplies the blood to the lungs, whereas the left one supplies the blood to body, so it has to apply more force than the right one. Both ventricles are separated by interventricular septum. Let me show you. This is interventricular septum. Right atrium collects the blood from the body and left atrium collects the blood from the lungs. The blood collected in the right atrium from body is deoxygenated and lack of nutrients. The body has sent back the blood which it has used to get oxygenated from the lungs. Right atrium will send it into the ventricle to be sent into the lungs to get oxygenated. And left atrium will get that oxygenated blood to send it into the left ventricle to get sent into the body. So the right atrium gets the blood from the body and left ventricle send it to the lungs. Left atrium gets blood from the lungs and left ventricle send it to the body. Now let's see how the heart collects and donates the blood. Of course, it do it by the vessels. Major blood vessels connected to the heart are aorta, superior vena cava, inferior vena cava, pulmonary artery, pulmonary vein, and coronary artery. Coronary arteries are blood supply of heart. Superior vena cava collects the blood from the upper body and inferior vena cava collects the blood from the lower body. Pulmonary artery takes blood to the lungs. And this all blood is deoxygenated. Pulmonary vein gives the blood to the atrium and aorta takes it to the body. One thing to focus here. The veins of the body have deoxygenated blood, but the pulmonary artery is the one who carries the deoxygenated blood. And the arteries of the body have the oxygenated blood, but the pulmonary vein has deoxygenated blood. So with this, the definition of the arteries is the vessels which take the blood out of the heart, and the definition of the veins is the vessels that take the blood towards the heart. Now take a look of heart valves to finish the video. There are four valves in the heart. They are actually the doors of the heart that ensure the unidirectional blood flow. So those four valves are tricuspid wall, pulmonary wall, aortic wall and mitral wall. Tricuspid wall has three leaflets. Let me show you. These are three leaflets of tricuspid wall. It allows the blood flow from the right atrium to right ventricle. It opens to give a way to blood from atrium to ventricle and then closes to restrict the backward flow. This is pulmonary wall. Pulmonary wall also has three leaflets. Let me show you. This is pulmonary wall. Now blood has entered into the ventricle. Now heart will contract and push the blood into the pulmonary artery. As the heart contracts, this wall will open to give the way to the blood to the pulmonary artery and then closes to restrict the backward flow. This is mitral wall and it is between left atrium and left ventricle, and it also allows the blood flow from the left atrium to the ventricle and then closes to restrict the backward flow. This is aortic wall. This is between the left ventricle and aorta. Blood flows from the left ventricle to the aorta and the wall closed to restrict the backward flow. All the walls have 3 leaflets except bicuspid or mitral wall. That's why it is also called bicuspid, means the wall having 2 leaflets. With this, the basic physioanatomy of the heart is complete. We will see the vessels in detail in the next video. Till then, Khuda Hafiz.